Thank you. Franciscans International has now a video statement.
Through Franciscans International, I deliver this statement as part of the Fiji Joint Civil Society Gender UPR Working Group. Despite commitments, systematic barriers rooted in harmful norms continue to impede progress towards equality, inclusion, and safety for all gender identities. Fiji's failure to fully meet international obligations such as CEDAW and CERD reflects ongoing gaps in policy implementation, reporting, and enforcement. Discriminatory laws and practices unequally affect women and gender diverse persons in areas such as political participation, economic empowerment, and access to justice. For instance, recent legal challenges reveal the persistent barriers faced by gender diverse communities in asserting their rights. Women and gender diverse communities remain underrepresented in decision making, with only 9% of parliamentarians being women, an indicator of limited gender equality in leadership. Online harassment and restrictions on peaceful activism further threaten the civil and political rights of activists, including women human rights defenders and gender diverse advocates. Fiji also lacks comprehensive gender and anti-discrimination legislation, hampering the efforts to achieve real equality. Without urgent reforms and proactive civil society engagement, systematic inequalities will persist and the rights of all gender identities will remain at risk. We call on Fiji to strengthen legal protections, ensure timely access to justice, and foster meaningful participation of women and gender diverse communities in policy making to realize the full spectrum of human rights for all.
Merci. Je passe la parole à
Thank you. International Women's Development Agency now also has a video statement.
I deliver this statement as part of the Fiji Joint UPR Civil Society Organization Working Group. Fiji continues to face persistently high levels of violence against women and girls. Despite the launch of the National Action Plan, survivors face systemic challenges, including under-resourced frontline services and a justice system that often fails to respond. We call on the state to institutionalize gender and disability inclusive training for law enforcement and the judiciary, and urgently review the Domestic Violence Act to reflect the gendered realities of violence. The sharp rise in teenage pregnancies and HIV cases in Fiji highlights the urgent need for sexual and reproductive health education and service delivery. Young people, persons with disabilities, sex workers, and the LGBTIQ+ individuals continue to experience unequal access to health care services due to persistent stigma, discrimination, and systemic obstacles. We urge the state to finalize the reproductive, maternal, newborn, child, and adolescent health policy, legislate comprehensive sexuality education, and ensure inclusive sexual and reproductive health services are resourced and accessible to all. Persons with disabilities and SOGIES populations remain underrepresented in national policies and face disproportionate violence and exclusion. We urge the state to develop a national gender equality, disability, social inclusion policy, carry out a national disability infrastructure audit, and allocate funding to ensure accessible services and responsive justice mechanisms. We reaffirm our commitment to working together with the state to uphold the human rights of all persons in Fiji without discrimination.